Good morning, everyone. At this time, I will recognize Mr. Devin Macaranis to call the roll of the EAGI committee in service today.
Senator Selena R. Babauta,
Present.
Senator Karina L. Magofnia, Senator Paul A. Manglonia,
Here.
Senator Donald M. Manglonia.
Present.
Madam Chair, all members of the Senate EAGI committee are present.
I just wanted to note for the record that Senator Corina Magofnia is in the building and she will be joining us shortly. She's just running a few minutes behind schedule. Appreciate your patience with that. With all members present, we have established the requisite quorum to conduct today's meeting, and I hereby call this meeting to order. Moving along with the next item on the agenda, administrative and housekeeping matters. It is now 10:30 a.m. on this Tuesday, September 12th, 2023, and I want to welcome everyone here to your Senate chamber. We begin our confirmation hearing this morning of Ms. Phyllis Seven Chong, and this afternoon we will continue the hearing for the nominees for CEDA, Commonwealth Economic Development Authority nominees. Miss Phyllis Chong was nominated on June 23rd, 2023 by Governor Palacios and to serve as a board of trustee for the Commonwealth Healthcare Corporation. I also want to say saludos and bienvenido para todos. Hamzani mane ega gwenogi salan mizo para sino aposentun mizo. Gwenogi Facebook para YouTube. Gohu si Selena Babauta. Gohu i sumisid biamza como manehantin estina komitea i executive appointments and government investigations. Estina komitea obligado por evalúa y cualificaciones y man maapunta ni gobyerno por fan maned big board siha y commissions and i cabinet i executivo na ramas gobernamento. Antes di ba who introduce i man sasanog ni man manazuda man manasisti gi komitea zaun na betsuli pa gon rato na tempo mizzo put parabay na fan manungo i presenti gwini gi piso ni sanhilo na gumagi legislatura puri reglamento ni proma conducta pa Augustina hearing. I primer este na komitea ha agradeci cooperacion mizzo za por favor enfafaisin hamzo para impuno para o sino na silensyo i telefon mizzo gi el mismo tiempo. Segundo, pudi man ma-recorded gi Facebook, YouTube, zani NMI legislature page. No zana binafan manungam zo todos, especialmente i manega gwano huzung gi sanizung siya na zangin sa kaso na necessario pa tafamparo rato pat para tafan descansa. I Facebook sempre ako tinuwag no mo live stream sa tisinya no inapara no. Moving along, introductions. Gid mismo tempo, daw na ba introduce i empleyado i legislatura ni man manasisisti, gi komitea pa ogan. Pero gahad biso zang kinuprendi tat como interpretin ni line ni aplicao gwini na junta presenti abogado a Senyor Jose Bermudez. I individual ni encargao para produce report este na hearing si Devin Macaranis. Para ugaha reglamento, gwinigi piso ni Senate, presenti Sergeant at Arms as Senor Benter Lahi, zani nuevo na Sergeant at Arms as Brendan Manglonia. Zan pun ultimo, irresponsable pro records o na siguro na klaro todo i microphones and official na electronics gini. I IT assistant as Senor Delbert Camacho, presente loque. Moving on to the adoption of the agenda. For the record, the notice on the agenda for today's hearing was issued on September 1st, 2023, in compliance with applicable Senate rules and the statutes. I now recognize Senator Paul Manglonia for the proper motion to adopt today's agenda.
So move, Madam Chair.
Thank you, Senator Paul has offered a motion and has been seconded by Senator Corina Magofnia. And are there any concerns or objections to the agenda? There being no objections or challenges raised, the motion hereby passes. At this time, I would now like to invite Mr. Oscar Babauta and the nominee, Ms. Phyllis Samanchong, to join us in the chamber. And Mr. Babauta's role here is to formally present the nominee to the committee before we begin our questioning. Mr. Babauta, you may proceed when you are ready.
Isus Marisi. Lieutenant Papa. I hope you guys can see me. Thank you, sir. Good morning, Madam Chair. Buenos dias para Hogos and totally member ni EAJ Committee, Senator Donald Malone, Senator Poe, and of course, always nice to see Senator Karina back on the floor. Welcome back. Alfaray Antiro, Chairwoman Selena Arvata, and the honorable members of the Executive Appointment and Governmental Investigation Committee. For the record, my name is Oscar M. Babauta, the Special Assistant for Administration under the Office of the Honorable Governor Arnold I. Palacios and that of the Honorable Lieutenant Governor David M. Apateng. I'm officially here to formally introduce the Governor's nominee for the Commonwealth Healthcare Corporation Board of Trustees, Miss Felice Simon Chong, who is currently seated to my right to represent the 3rd Senator District, the island of Saipan. Ms. Phyllis Chong is a professional individual with an over 20 years of experience in medical field, which includes providing direct patient care and managing value-based care. Ms. Chong received her master's degree in social work at Notre Dame School, Indiana, and her Bachelor of Arts at Loyola University of Chicago. She has also obtained her license as a clinical social worker here in the Sinamay and the state of Illinois. Governor Palacios and Lieutenant Governor Apateng place their complete trust and confidence in the likes of Ms. Chong to serve on the Commonwealth Healthcare Corporation Board of Trustees. I know she stands ready to answer your questions and present our plans for the future of our healthcare system. Her long history of professional experience, credentials, commitment to serving the Commonwealth in this capacity makes her a viable candidate, and we kindly ask for your expeditious approval through this executive committee and appointment committee, and hopefully towards the full Senate in the not too distant future. Thank you, Madam Chair and members of the Senate, Galisso, for the opportunity to introduce Ms. Chong to all of you again this morning. I know we'll be seeing each other this afternoon at 1:30 again for additional nominations. So I will leave now the floor for the others and extend our best to Ms. Chong as she endures this short and brief hearing this morning, and likewise extend our appreciation to her families and supporters alike who are currently in the gallery to cheer for Ms. Chong this morning. Thank you, Madam Chair and members. Good luck.
Senor Babauta. I now open the floor for public comments. For those who will be making public comments, I invite you to come and join us in the chamber next to the nominee. And I ask that you please keep your statements to 5 minutes. And if you have any written comments, please submit them to our Sergeant at Arms so we can make them a part of our official record. Thank you. And please state your name for the record.
My name for the record is Vincent Joseph Semen. Okay, to continue.
Yes, you may proceed.
Good morning, Madam Chair and the distinguished members of the Senate Standing Executive Appointments and Government Investigations Committee. My name is Vincent Semen, son of Bernardita Tequera Semen and grandchild of Felipe Semen. It is my honor and pleasure to stand before you today to extend my full support of the nomination of Phyllis Semen Chong to the Commonwealth Healthcare Center Corporation Board of Trustees. I'm sure you are all too familiar with the adage, it takes a village to raise a child. That theme was central to the formation of this nominee sitting here before you today. To say that healthcare is in our blood is an understatement. Starting with our grandfather, Felipe McGinnis Semen, who was a trained pharmacist at the old General Japanese Hospital, and our grandmother, Maria Yoshie Takeda Semen, who came to Saipan from Japan as a nurse and worked also at the Japanese hospital. They were instrumental in saving countless lives before, during, and after the war. Our uncle Josie Semen spent most of his career at the Dr. Torres Hospital. Our cousin Norma Ada is a successful physician who also applied her talent and skills at CHC. We are fortunate that Phyllis particularly took to continuing this focus and interest in the field of healthcare. I am confident that she will exhibit the requisite qualities that are demanded of a trustee for our hospital and our people. For essentially all her life, particularly the last 20 years, Phyllis has been honing her knowledge and skills as a healthcare professional. Having gained valuable insight to so many facets of healthcare service industry, Phyllis is ready to take immediate positive impact on our CHCC, which is the lone full-service hospital serving all the Sinamay citizens. Phyllis's background and experience speaks for itself. I can continue with professing all her qualifications, but let's be frank, actions speak much louder than words. So I'll stop here and urge each one of you, members of this community, to also take action. Approve Phyllis's nomination and let her service speak for your wise decision to extend the same confidence that Governor Arnold Palacios had in selecting Phyllis to do what is best for CHCC and our people. Thank you. Jesus Masi Olamoy. Domo arigato gozaimashita. Salamat po.
Caesar's Mose, Mr. Seven, the floor is still open.
My name is Norma Semen Ada, and I am here to support the nomination of Phyllis Chong. I've been practicing medicine in Saipan since 1997, and just like it does take a village to raise a child, it also takes a village to really carry out the goals in the healthcare system. And one of the most important folks in this healthcare system is really the frontliners. And then I'm not talking about the ones who take your temperature and your blood pressure, but the other facet of healthcare is really the life and work of a social worker. The social worker offers a unique perspective in the healthcare team. They go to and often speak to the individual, to their families, and they try to understand the system in which supports the patients. And I think the perspective as a social worker is very important in any healthcare organization. They listen, they investigate, and they also really work very, very hard to make available resources available to the patients. And then they translate that information to the healthcare team. And I think having a social worker is a wonderful and excellent choice to any board of trustees in a healthcare organization because they offer a unique perspective. The perspective of affordability of medicine, transportation, what is going on in the home of the patient, or what is the support system of a child. And I think Their perspective is so important when major healthcare decisions are made for our public health hospital and our Division of Public Health and all the delivery systems that help partake in keeping our islands healthy. And I fully support her nomination as an individual, but also what she represents in her profession. Thank you.
Cesar Smasi, Dr. Norma Ada. The floor is still open. Nobody else? Thank you. We will now close the public comments portion until later on this afternoon when the other nominees appear before this committee. I will now recognize Mr. Devin Macaronis to administer the oath to Ms. Chong. May I ask you to please raise your right hand?
Ms. Phyllis S. Chong, you do solemnly swear under the penalty of perjury that the testimony you shall give in the matter at hand shall be the truth, the whole truth, and nothing but the truth. Thank you.
Thank you, Ms. Chong. For the record, we also received letters of support from Dr. Ramona Batia. I'm not sure if I pronounced that correct. HIV Consultant Center for Global HIV and TB U.S. Centers for Disease Control and Prevention. Ms. Kelly Piggott, Director of Ambulatory Care, Coordination and Post-Acute Network from Northwestern Memorial Healthcare. Dr. Robin Dorman, psychologist and former colleague of Ms. Chong from Northwestern Hospital, and Dr. Esther Munoz, CEO of the Commonwealth Healthcare Corporation. Additionally, the committee has not received any letters in opposition of your nomination, Ms. Chong. And at this time, I will give the floor to you if you would like to make opening remarks for the committee. You may proceed when you're ready.
Good morning, Hafadays and Tarawami, Chairperson, Senator Selena Babalta, and to all the members of the Senate Standing Executive Appointments and Government Investigations Committee. Thank you for convening this additional hearing today and considering my nomination. Thank you to Special Assistant Oscar Babalta for the generous introduction that you have provided. Thank you to Governor Arnold Palacios and Lieutenant Governor David Apatang for their confidence in entrusting me with the responsibility of being part of the Commonwealth Healthcare Corporation Board of Trustees. I was born on Saipan to my parents Victorino Santos Chong and Esther Semen Chong. I am proud to be named after my grandfather, Felipe McGinnis Semen. For over 20 years, I gained valuable professional experience in the healthcare field, primarily in Chicago. The hospitals that I have worked at includes the top 2 ranked academic medical centers in the state of Illinois. My previous experience includes providing direct clinical care to patients, as well as being in a leadership position as a manager. As a clinical social worker, I sat at bedsides in patients' homes, skilled nursing facilities, hospitals, and outpatient clinics, where I supported patients, families, and caregivers through a variety of different life events, which included experiencing the joy of having a first child to the immense grief of losing a child, helping children who were wards of the state reunite with their families, and also working with parents who were not quite yet ready to safely parent. I also supported patients when medical teams communicated the difficult news about a terminal condition. I witnessed the suffering experienced by patients at various stages of a medical illness, including at the end of life, when all curative medical interventions were exhausted and death was inevitable. At the end of the day, as a trustee, I will continue to keep in mind that our ultimate purpose is to support our patients with compassion and dignity. I have been in the front line when major changes such as the Affordable Care Act necessitated reforms to healthcare delivery, prompting hospitals to reorganize in anticipation for changes in reimbursement and revenue. Later, I witnessed how hospital operations quickly pivoted because of the COVID pandemic. I have seen how the culture of an organization is crucial to supporting a hospital and weathering the changes necessary and ultimately leading to improvements in care and innovations in care. The hospitals I worked at were academic medical centers, which meant that I worked alongside physicians who were also scientists working on research to provide evidence-based care. When I was in a management position, I rose to the challenge of leading a high-performing team through a major departmental redesign during a time when the hospital was financially recovering from the COVID pandemic. Among other things, I onboarded, provided clinical and administrative supervision, performance management, and goal setting with an emphasis on aligning those goals with the hospital's strategic goals. The redesign resulted in a 100-plus person ambulatory care management department. This was an important endeavor for the hospital operations as it supported the clinical care needed to achieve key performance indicators and to be able to meet its financial goals. Despite being far away, I have not forgotten how our culture and cultural health beliefs contribute to how we view health. This is an important factor to be considered because essentially a healthcare organization's performance is dependent on the health outcomes of the patients who are served. The CNMI has faced tremendous challenges with maintaining a comprehensive healthcare system in an island community thousands of miles away with its unique culture and traditions. In fact, my earliest memory of receiving medical care not only included a trip to the emergency room, but also treatment from a suruana. I'm very cognizant that our local healing traditions are very important to our community. The importance of culture extends to the culture of an organization, which is reflected in its expectations and practices that help inform how an employee carries out their day-to-day work. CHCC's value statement indicates that it is committed to exceeding standards by providing a culture of compassionate, effective, quality care, honoring the dignity of its stakeholders and community, and promoting equity and transparency, as well as continued accountability and growth throughout the corporation. I will commit to maintaining those values. The interpersonal skills that I will bring with me on the Board of Trustees includes a strong ability to analyze a situation and make informed procedural plans, critical thinking when making decisions, effective communication with professionals from different technical backgrounds, and a strong sense of working with teams where doing what is right collectively to advance a patient-centered mission supersedes individual gain. My experiences have taught me that healthcare is not limited to the walls of the hospital, but that the hospital is just one of those places on the care continuum. If confirmed, I will continue to uphold the culture of excellence that I have demonstrated and will commit to working alongside the CHC leadership team to continue to set and work towards achieving their strategic goals while considering the importance of maintaining the health and trust of our community. Thank you, Sizus Maasi and Olamoe, for this committee's consideration. And most importantly, thank you to my husband and my family for their continued love, support, and encouragement.
Cesar Mosse, Ms. Chong. Ms. Chong, your nomination requires the advice and consent of the Senate, and today's hearing is actually the second step, the first being the nomination from Governor Palacios. And this is the legislature exercising its authority under the Constitution and laws to vet the nominations nominated by the executive branch. I just wanted to let you know that each member of this committee has a duty to ask probing, inquisitive, if not exploratory questions of you to determine your qualification, temperament, and professionalism before this committee. In this hearing, we will be asking questions of vital concerns to the community and to the committee as well. I will now open the floor for the members to begin their questioning. And who wants to go first? Recognized Senator Donald Magnolia.
Thank you, Madam Chair, and good morning and congratulations on your nomination, Ms. Chong. Um, as a former educator, I constantly encourage our students to go out there and explore and gain the experience and come back and give back. And so thank you for coming back and serving your community in this capacity. Just looking over your resume, it looks like you've been away from the CNMI for quite some time now. Since coming back, have you had the opportunity to go into the hospital and whether as a patient or as a visitor? Have you had that opportunity to do so?
I've had the opportunity of doing both.
Okay. And based on your experience and based on what your understanding of the way the hospital is run, what would you say are some of the challenges that you've seen or experienced, and what are your plans to address those?
So I think you mentioned education, and actually part of the reason I moved back was because of the health of my father. You know, it was difficult to be in Chicago and sitting in these meetings, creating these plans and procedures for a department and hearing about all the resources we had to take care of a condition such as what my father had, and we lacked those resources. So one of the first experience that I had, which opened my eyes to the reality of maybe how under-resourced we are and how there is a lot of room for improvement, was when I came back and my father had an extreme change in his condition that made us all worried. And one day he said to me, you know, I wasn't like this until I took a certain medication. So I said, okay, we'll stop that medication. I talked to somebody from the physician's office, and it turns out that the side effects he was experiencing was in their eyes normal. So I gave feedback to the nurse. I said, if that was in fact the side effects that you expected, I only wish that you would have educated my family that that was what to be expected. Because if anyone would have seen the side effects that he endured at that point, we didn't think we had long with my dad. And I believe that our healthcare providers, all the workers we have in the hospital, are doing the best, given what they have and what they know. So to me, I provided feedback that maybe more education to the family, the caregivers you're sending the patients home to, would have been helpful in this situation. So I think it's around education to our providers. You know, as providers, what I have seen is our doctors, nurses, they provide us that anticipatory guidance when dealing with an illness. As patients, as caregivers, we don't know what to expect sometimes. We don't know what questions to ask. I think that's one area of improvement. I think our facilities, as we all know, need to be updated. I sat with my father at the bedside. You know, we all have our turns to be the toban, right? So, you know, spending 12 hours a day with him at the bedside, I could hear what the patients next door were going through, what the discussions that were being had. So I was concerned about privacy. That's another thing. But I think, again, we're limited to the facility that we have. I know we have plans to update those facilities. And I think the other thing that stands in my mind, too, is we revere our manamko. So when you talk to them, I think we got to be careful of our language. You don't infantilize them. You don't treat them like they're 3-year-olds. I think that's another experience I had when I was there, which, you know, already being in the hospital bed is vulnerable for our manamko. So I think we got to be careful about that. So when I talk about cultural competence, that's and bringing culture into how we deliver healthcare, I think that's an important factor as well. So, again, I think we're comparing two very different hospitals with very different resources. And like I said, I feel every healthcare provider is doing the best they can given what they know at the point. So
Thank you. Thank you for sharing that. And I hope that when confirmed, you also look at the way things are being run on Rhoda and Tinian, because a lot of the things you mentioned are issues that we also face in these districts, but we feel that affects tenfold because of the lack of resources and also being able to provide enough information to the patients to seek better care elsewhere or take quicker actions if a patient is experiencing some level of difficulty that could not be addressed in those districts. And so I hope that while you are representing the third senatorial district, you're essentially making decisions for the entire Commonwealth. And so I hope that more emphasis is placed on trying to equip our other clinics with the staff that can help provide those informations to the patients. I do want to just, again, for those of the viewing public who aren't fully aware or privy to the information that you provided the committee, like your resume, I do want to point out several points that makes you well or qualified to serve in this capacity. One of the things you oversaw was the coaching and training social workers and registered nurses, design, monitored, and improved processes that support network-based providers. You didn't mention one thing, and that is to reduce readmission and avoid admissions. And so with that, what are your plans or what are some initiatives that maybe you plan to implement if serving as a trustee?
Yes, and I think I'm going into this position aware that maybe there's already some things in place at CHC, avoiding readmissions, reducing inpatient hospitalizations is an initiative that I think all hospitals are taking. So I'm curious to see if there's already initiatives in place. I was an outpatient social worker, and one of the things we emphasized was that if we can do the care right in the outpatient, if we can support a patient so that they follow the medical plan of care when being diagnosed with a chronic condition, we wouldn't have to see them in the inpatient hospital setting, right? We do the best that we can when they're at home in the community, so that our acute inpatient setting is used for, the car accidents, the tragic events, the acute events that happen. That's really the goal, was to make sure that we had enough hospital beds to treat those emergencies that really happen due to an unforeseen reason. So to do that, are we educating our patients? Do they know the side effects of the medication? Do they know how to use the emergency room? I think it's easy. I think maybe as a community and culturally in many different cultures, when you experience an acute event, we panic. We go to the emergency room as the first line of defense, which in some cases is very normal and acceptable. So if we provide the right education to patients, we can probably reduce an unnecessary admission, free up our ED so that we in fact can take care of those acute needs. That's one reason. So I think if we can do our work on the end and the outpatient side, and provide the patients with the resource, understand what the barriers are there for them to taking their medication, et cetera, we can maybe reduce some of that unnecessary hospital admissions. And again, the teaching of the caregivers, making sure that they know what to do and how to care for the patient when they leave the hospital.
Thank you for that. I think even a closer partnership with PSS, maybe start push out more information to the schools. I know vaping has increased significantly amongst our students, as opposed to chewing or smoking cigarettes now. But even with that shift in these new technologies and new ways of doing something differently, right? That's something that we can start and focus more of our efforts on in starting to release information at such an early age. The other thing that I wanted to focus on or maybe just bring up, and hopefully this is something that you can also look further into, is just the whole referral, the health network program, which is basically the referral, whether inter-island or off-island. A lot of our money is spent on sending patients out, but how can we find grants, or what are ways in which we can invest in equipments here so that we don't have to send our patients elsewhere? But also, I know that there's discussions with CMS, the Medicaid agency, and I'm not sure what the update is in regards to is if the state plan was approved, but I know that was one of the efforts made in trying to seek foreign countries to accept our patients so that we can spend less on referral to U.S. mainland. That is all I have for now. While I provide other members the opportunity to answer their questions, I yield at this time, Madam Chair.
Thank you, Senator Donald Manglonia. Anybody else? Recognize Senator Karina Magofnia.
Thank you, Madam Chair, and welcome, Phyllis. Congratulations too on your nomination, and I would also like to thank you for deciding to come back, even though it's, because of your father's health, but even just considering on taking on this responsibility. Looking at your resume, it is quite impressive, and as Dr. Ada has eloquently conveyed to the members, how important a perspective of a social worker is to the board. I'm very grateful that you have taken the consideration to take on the position. So, in looking at your resume, I am quite interested in getting a little bit more, perhaps. If you could just elaborate a little bit on the part where you had influence in quality outcomes, and also leveraging leadership and critical thinking skills to scope, initialize, and operationalize large-scale initiative. I am curious to hear what your thoughts about that and how you hope to bring those skills to the board should you get confirmed.
Sure.
Thank you.
So one of the largest projects that I worked at was the departmental redesign. So we had a team of social workers, we had a team of nurses, we had patient care navigators, all being assigned to different projects. So our referral system for utilizing our support services was a simple referral in the EHR. A doctor in a primary care clinic can identify a social work need, for example, put in a referral, and it will go into some sort of work queue. We found that the work, we were doing redundant work. We had some social workers that were non-insurance based, and some we had to assign by insurance. So we saw that that was not as efficient as we thought. So that really led to this departmental redesign. So when in that redesign, we really had to take a look at was this process of anybody can put in a referral, let's wait a few days and see who it needs to go to. It was really slowing down a referral process. So the time it took to respond to a patient and the need. So one of the quality initiatives would be, let's take a look at how we can do that better. There was the concept of doing one large department. And really, it was taking a look at whatever work that we had. So, for example, putting screeners together, we needed to get the buy-in. So screeners, to really identify psychosocial needs, we tried to take an innovative approach. Let's do that first, and then identify patients. Was that working? Well, we found that that didn't really work because we needed to convince a provider that in your 15 minutes of seeing the patient, can you please include this questionnaire, which was a lot to ask. So we pivoted that as well. And so basically it was identifying if this process was in place, if it wasn't working. We really took a look and, encourage feedback, not only from our stakeholders, like our physician champions, but our patients and especially the people doing the work. So, I think part of the organizations I worked with really looked at, input from everybody doing the work. We created an atmosphere where, your opinion mattered. Give us the feedback, rather than having a disgruntled employee sit there and not do the work and just be angry. So it was really taking a look at what worked and what didn't work. I think the other thing too is, we had a culture where it was, if you make a mistake, it's okay, but let's learn from it. And I think one of the advantages that we had was everything was data driven. One of the ways that we designed which patients we would target in terms of offering care coordination services would be using a list where we would take a look at what was in their EMR to identify high-risk behaviors, high-risk medical conditions, to be able to know who do we serve. So creating policies and processes around that. So really everything that we did, we found that it was helpful to iron out a step-by-step policy and procedure. Yeah.
Thank you, Senator Magofnia. Senator Paul Mangloni, would you like to ask questions?
Senator Monsi, Chair.
Recognize.
I too would like to thank you for accepting this appointment by the governor to be a member of the CHCC Board of Trustees. I'm so glad to see another nominee come before us who have really very impressive resume. Can I ask, where did you go to high school? I mean, you
So
listed
I'm
down Notre Dame, University of Notre Dame.
Yeah. So I was at Mount Carmel from 1st through 9th grade, and
Okay.
then continued in California. I went to St. Bernard High School in Playa del Rey, Los Angeles. Yep.
Mhm. Okay,
Yeah.
great. Yes, you have a very impressive resume, and I have to say that we can sleep better at night now, knowing we have another young and brilliant student from the cinema who went out, work, and come back to help. And I'm sure that since coming back, you said because of your father's illness, or just want to come back, you now by now understand the challenges we face with our hospital, right?
Yes.
You have a better understanding, and so I'm just I really don't want to ask many questions because I think knowing your experience and I guess uh, your education and background and knowing your families, the Seman family, right, and the Chong.
Mhm.
I see a lot of families back there, and they're all helping out in our community. And I know that coming from those families, I know you do a good job also in this new role that you're going to be playing for our community. But I'm just going to ask you: have you ever been to Rhoda or Tinian?
I've been to Tinian as a kid, yeah, but
Oh.
haven't made it to Rhoda.
You haven't been to
it's-
Rhoda, so-
Yeah,
okay.
we plan to go there.
So I have a lot of questions now, Madam Chair. Well, I asked that because so maybe I'll just spend my few minutes on Rhoda. It's very tough to be a resident of Rhoda and you're in need of health care. If you have dialysis, you have to move to Saipan practically. You stay in Financisu, a small room there, try to squeeze your family, right? And get dialysis treatment here. You have to move the whole family.
Wow.
If you're pregnant, you have to move here maybe 1 month or 2 months before, right? And if your husband is working, your husband have to take a leave of absence. And when you take a leave of absence, you need to borrow sick leave, right? Or something. So you have to also move your family and then worry about your job. You're lucky if you have a public work job here that they can transfer you temporarily, right? And maybe your kid, if you have a young kid, you have to also send them to school here for 2 months. Even for dental, right? So it's very tough.
Yeah.
And I don't know how to relay that to so that people can really feel it. I like what you said when you say the hospital is not the four walls, right? So there are technologies today. There are telemedicine, right? Out there, there are things that we can try to see outside the box to see that we can offer this medical advice or treatment over the phone or over video conference. I think that we need to start thinking like that. Um, I remember a few years back when you need to get your blood work done on Rhoda, you have to take money from your pocket and make sure that it gets sent to Saipan. We have to help sometimes our patients find local funds to pay for that, so that they can send their lab specimen to Saipan. And so medical referral from day one, we define to mean any medical service you need uh, to go off island. And for inter island, that means Rhoda and Tinian going to Saipan, that's medical referral. And for our people here in Saipan, sometimes we're fortunate because we have all the basic services. But for Rhoda and Tinian, sometimes even the most basic, you you uh, you just have to fly, go out. Sometimes it's a lot cheaper to go to Guam. So people just take it out from their pocket and they go to Guam, sacrifice family money, right, just to go to Guam because it's faster, near, and they got a brother or sister there. So those are the challenges for someone from Rhoda. And that's costing us a lot of money because they're housing them in Financiso or Navy Hill. And fortunately for the hospital, maybe they don't cover some of that, but we have to find local funds. But now we're challenged with local funds, and I'm just worried about these patients now. So that's something that in addition to all the other problems that we have, we need to look at that also to cut the cost down, but not necessarily to sacrifice the care and services. So even I know of a veteran that has to fly to Guam or Saipan. That person couldn't even get on the plane because they don't have a hydraulic lift to get on the plane. And so before we had this other airline that's kind of like very low, just 2 steps you get on, so they can get on that. But with the Star Maranas, I think they're having a problem. And so we have all these small things we can, when you add them up, it's actually a lot of challenges. So I'm just going to ask you to take a look at that whenever you have discussions on healthcare. Always consider the challenges of these people from the other islands. That's all. If any message today, it's that I appreciate. On dialysis, we spent almost $2 million 15 years ago to build a facility next to our clinic. It's done. It was done since 15 years ago. First, it was like $1.5 million, then another $500,000. We did a dialysis facility. We put in reverse osmosis. I think it was just the chair that we needed, but then it just got stuck. It never moved. But I'm very hopeful now because with telemedicine, you don't need to hire a nephrologist, right? You can probably just use the one here and just go over the phone. Just put a qualified nurse down there or work with the doctor down there to also have some experience with dialysis patients, and those that are not very critical, we can possibly treat them down there. I don't understand, in Guam or in the US, they have facilities almost in every corner of the city, in the
Yes, that's true.
where the houses, the homes are. So I think that's something that we can maybe revisit, with telemedicine, and we can be sending staff down there, maybe every other week. So that's what I'm going to ask you, Phyllis. I think as a social worker, I know that you'll be concerned with our patients, and I have every confidence that you would look into their medical needs. So thank you, Madam Chair. Do you speak tomorrow, by the way?
Yes.
Oh, good,
Okay.
good. Okay, so
So thank you so
that-
much
that-
for
that's very
sharing
good.
that. Yeah.
Okay, so si Diyos masi, takilo inangukuno ako Phyllis,
Okay.
utunga da no se comprende na si Pimas maulig isid bisyo sa igo may gemo gano da si Diyos masi na acceptesti na nomination in Governor Palacios and Lieutenant Governor Apata. Thank you.
Thank you. And
Thank you, Senator
yeah,
Paul.
Senator Manglonia, if I can add, I've, followed politics on Saipan for a long time. I know you're a champion behind a lot of our scholarship programs and making sure that that's available to our students. So thank you for your work in that.
Thank you for those flattering comments, but Senator Manglonia is not up for hearing
No, yeah.
today. It won't do any good in this committee. Anybody else for a second round? Recognize Senator Donald Manglonia.
Thank you. I don't have any questions, but I do have a. I just want to add on to some of the stuff that Senator Paul has brought up, and this is going back to the medical referral. Fortunately, last month we confirmed Rhoda's trustee to sit on the board of trustees, and I'm hopeful that she will continue fighting for the patients of Rhoda. But I do want to share the concern with you so that you can maybe work with her and see how you can address this. As recently as last month or earlier, late last month, another patient lost her child, but I don't know if this is at the fault of CHCC or RHC for that matter, because it seemed like it took a while for the provider to either refer the patient to Saipan to seek better care, but just knowing that the clinic's not equipped to handle an event like this, child delivery or premature babies, and so there has to be a greater focus and push in addressing the concerns of expecting mothers at any stage of their pregnancy. Earlier this year, we also lost a child because it took hours to medevac that baby to Guam. And so concerns like these, if it happened once, it shouldn't happen again to somebody, especially if it's a first-time parent or. So just addressing stuff and taking quicker action and addressing the concerns of patients and listening to the patients, but also we need someone there to fight for these patients. Thank you.
Thank you for sharing that. Thank you.
Thank you, Senator Donald Manglonia. One of the most significant challenges that CHCC faces, and it's also a challenge for the legislature, because we are tasked to provide a budget that is never adequate for CHCC. But one of the most challenging issues facing CHCC now is their cost of energy. I think you may have heard or read in the paper about the significant arrears to CUC from CHCC, and I think there's an agreement that is in place right now. And as far as we know, based on our conversations with CHCC management, they are current or adhering to the agreement that was agreed upon to both agencies. But we understand your limitations having no interaction with the board yet that we know of. I don't know if you've attended as an observer any of the board meetings. So we understand your limitations in answering some of the more serious concerns. But I'd like to hear from you, should you be confirmed to sit on the Board of Trustees. Any ideas? You've worked with cost reduction measures in other medical centers that you have worked for. So I wanted to ask you, do you have any ideas or plans to implement that particular area of the hospital that certainly needs to be looked into?
Yeah, you bring up a great question, is also a wonder of mine, which is what cost containment actions have been taken. You know, departmental redesigns are one way that hospitals have tried to cut back costs. I've been through a time when our PTO was cut, looking at benefits. What can we cut back on because they may be underutilized? So I do have some ideas in terms of maybe non-personnel costs that could be cut. Of course, taking into consideration that we can't compromise patient care. You know, another big deal in institutions is position control. And basically what that is to help contain costs is to really take a look at any new positions that haven't been filled yet. Are they necessary? Do we have the data to support that? Yes, we need one more person in a new department. So those are kind of the ideas I have. You know, I've been through cuts where we had to cut our education budget for our employees. You know, I did take a quick peek at the budget for CHCC's upcoming, fiscal year, and we have a lot of additional perks. And I'm wondering, during this time when other, areas of our government are being asked to cut employee hours, are there some of the benefits that we can cut for now, as we know that we are struggling, that CHCC is currently struggling to meet payments such as the CUC bill. So those are questions that I do have and would like to share if I'm part of the board, when I'm part of the board. But I think there needs to be some sort of review of that.
Thank you for your insight. And I bring that up because, like I said, it's a major challenge for the legislature as well. We've been asked, and a bill, in fact, has been introduced for your information to change the rate. CHCC is currently on the commercial rate. It's a 3-tier rate system at CUC, and CHCC is a government on government rate, and they're asking, and in fact, a bill has been introduced to change that to commercial, which is a tier below the government rate, and it's significantly cheaper, which would help alleviate some of that. There are arguments on both sides of the argument there, for and against. So that bill has passed the Senate, and it is currently in the House at this time. I don't have much questions. Just as the other members have stated, your resume is very impressive. And I have no other questions for you at this time. Are there any other questions from the members? Recognized Senator Corina Magofnia.
Thank you, Chair. And I just wanted to ask, based on your observations and your experience while at the hospital, what would you say would be your top priorities to recommend and possibly implement should you get confirmed? Thank you.
I think really taking a look at what the patient care experience is for our patients in the hospital, because I think that's really affects, how well a patient is able to manage their chronic condition, right? Because if we walk into a facility which we're not confident in their ability to care for us, how does that translate to an individual's belief that I should care about managing my chronic condition? So I think that to me goes hand in hand. We don't ever want to leave a patient. We don't ever want a patient to walk out of a healthcare facility frustrated, angry at their provider because they weren't provided the proper care. And so making sure that they're feeling heard, that we are as engaged as they are, as we would like them to be. Because really, I think also healthcare is a partnership. It's the provider, trusting your provider, to the patient, wanting to care for themselves, and feeling that there's people in the community that can help them, And I'm not, so I think that would be my hope, and so.
Thank you, Senator Magovnia. Are there any other questions from the other members? If not, that was a short hearing. Ms. Chong, there can be no doubt that the work experience you've accumulated over the years, coupled with your educational background, would carry you well should you be confirmed to serve as a trustee of the board of CHCC. And this committee, I think I can speak for everyone, has determined that you are not only exceptionally but uniquely qualified to be in a position to make policy changes at CHCC. And it is very refreshing to see women appointed, nominated in leadership positions. And so far, the administration has been batting 1,000 on that. We've confirmed quite a few female educated daughters of the CNMI. So we are very pleased to see diversity in leadership positions. I think women play an important role in leadership positions. Studies have shown that women leaders in communities show signs of a healthier and more robust community. So we are hopeful that you can make the policy changes needed at CHCC, and it would be our privilege and honor to recommend your confirmation to the full Senate body.
Thank you.
Do you have any closing remarks for the committee?
No, I don't, except again, thank you for your time. I know this was an additional hearing, so thank you for that.
Madam Chair, can I just ask, are you employed presently today or?
I am waiting for a final offer from a federal agency to continue doing social work on island. So yeah,
Okay,
I will be.
thank you. That is it. You are hereby excused.
Thank you.
This meeting will go into recess at this time until we come back this afternoon at 1:30. It is now 11:46 a.m.